This is the hip bone. The most important landmarks that we should know about it. That this hip bone is made of 3 bones. This is the pubic bone. And this is the ischium. And this is the ilium. In this pubic bone, this is the body of the pubic bone. On the upper border of this, I will find a tubercle, which is important. This is the pubic tubercle. Here is the ilium. This is the iliac crest. And the most anterior part here is the anterior superior iliac spine. So in this bone, we need to know the anterior superior iliac spine, the pubic tubercle, because these are the attachment of the inguinal ligament. Underneath it passes the femoral artery and femoral vein. The body of the pubic bone articulate with the body of the pubic bone of the other side. Is the same, right? To form what's called the symphysis pubis. This is the symphysis pubis. It lies exactly in the middle line. This is why the femoral artery, it enters midway between the symphysis pubis and the anterior superior iliac spine. This is the surface anatomy of the femoral artery. Midway between the anterior superior iliac spine and the symphysis pubis, or the middle line. The second bone is the femur. The femur has an upper end, it has a lower end, and it has a shaft. We are focusing on this tubercle, which is called the adductor tubercle. It's important to know it. It lies above the medial condyle of the femur. This is the adductor tubercle. It is important because if I know the surface anatomy of the femoral artery, I will draw a line from the adductor tubercle to the mid-inguinal point above, and I will take this line. The upper 2/3 of this line represent the surface anatomy of the femoral artery. So the adductor tubercle should be known well. At the back of the lower end of the femur, I will find here this surface. This is the popliteal surface of the femur. This is the popliteal surface of the femur at the back of the lower end of the femur. The popliteal artery lies directly on this surface. So I have to know that this is the popliteal surface of the femur, triangular. Concerning the tibia, this is the upper end of the tibia, this is the lower end of the tibia, and this is the shaft of the tibia. What's interesting for us is this one. This is the medial malleolus. It is a landmark, it is palpable. And as you know, in front of it, immediately in front of it, passes the great saphenous vein and the saphenous nerve. So I have to know this is the medial malleolus. Concerning the upper limb, this is the scapula. What's important for us is this process. This process is the coracoid process. The coracoid process gives the attachment of the pectoralis minor muscle, which divide the axillary artery into 3 parts. So I have to know this is the coracoid process. This is the coracoid process, which gives attachment to pectoralis minor muscle, which divide the axillary artery into 3 parts. This is the lateral border of the scapula, and this is the medial border of the scapula, and this is the upper border of the scapula. You know, anastomosis around the scapula, the subscapular artery passes along the lateral border. The deep branch of transverse cervical passes on the medial border of the scapula, and the suprascapular artery comes from this foramen. Both anastomose freely around the scapula. Concerning the humerus, which is the bone of the arm, the skeleton of the arm, the humerus has an upper end, it has a lower end, it has a shaft. The importance here is that the upper end has a head, which is hemispherical, and it has 2 necks. This is the anatomical neck, and this is the surgical neck. So if I mark this one, this is the surgical neck of the humerus. If I mark this area, this is the anatomical neck of the humerus. There is 2 tuberosities here, the greater tuberosity and the lesser tuberosity. And here is the bicipital groove. The bicipital groove is important for you because its medial lip gives the attachment for the what's called what? Pronator teres major muscle. Teres major muscle is attached here. And you know, teres major muscle, at its lower border, the axillary artery ends. So this is the bicipital groove. It has a medial lip, it has a lateral lip, and it has a floor. And the medial lip is the attachment of the مش عارفينها. This muscle اللي هي the teres major muscle. Teres major muscle. At its lower border, the axillary artery ends and the brachial artery begins. The teres major muscle. Teres major muscle. This is the lower end of the humerus, and this is the medial epicondyle. Medial epicondyle is important for you because behind it passes the ulnar nerve with the superior ulnar collateral vessels. So this is the medial epicondyle. This is palpable. So I have to know it. The medial epicondyle. I have to know that there is anatomical neck, and this is the surgical neck. And this is the bicipital groove. At the back of the humerus, I will find a groove. This groove is the spiral groove in which passes the profunda brachiae artery. The spiral groove at the back of the shaft of the humerus is an oblique line, oblique groove for the profunda brachiae artery. If I mark this like this, this is the surgical neck. If I mark this is the blue one, this is the anatomical neck. This is the head of the humerus. And this is the back. So this is the spiral groove. And this is the medial epicondyle. Concerning the radius, I'll find also the radius has an upper end, it has a lower end. The upper end has a head, and this is the neck of the radius. It is a landmark in anatomy because here the brachial artery ends at the level of the neck of the radius by giving its 2 terminal branches, the radial and the ulnar artery. I will find at the lower end of the radius, on its lateral part, I'll find a process like this is called the styloid process of the radius. It is also palpable and it is also a landmark for us. So this is the head, this is the neck, and this is the styloid process of the radius. This is the anterior surface of the radius, and the back was the posterior. This is the posterior surface of. So what's important in radius? The neck of the radius, the head of the radius, the styloid process of the radius. شكرا.